Thanks, everybody already connected.
Hello,
Hi, Natalie. Good afternoon.
Hey, thank you for having me.
We have had some... Excuse me? Everything is a little bit jet-lagged.
Sorry, you cut out there. What was that?
I think we have had some technical issues, but now everything seems to work more or less.
Yes, I think hopefully it will run smoothly from now on.
Fantastic, fantastic. Okay, Natalie, let's start. We have some people already online, and I'm asking everybody that have any question for Dr. Bolding to write. I will try to take note and then answer to everybody.
Perfect.
In the meantime, I would like you to introduce you. Dr. Natalie is a very good doctor. We met she works in London. And tell us a little bit what you do, where you work, what's your experience.
Yeah, so thank you for having me, first of all. I'm Dr. Bolding, and I'm working with Nova Clinic, which is in Greenwich, London. It's a fantastic clinic in London. We offer a wide range of aesthetic services, and we are very proud and very honoured to be rolling out the Endolift technology across the UK market, which of course was pioneered by yourselves at Eufoton, using the fantastic LASEmaR 1500 machine, which is extremely versatile and, as you will see, has some incredible kind of effects across a wide range of body areas. And my experience in the aesthetic industry is several years, about 4 years, working as an aesthetic doctor, specialising in injectables and laser treatments.
Fantastic. Very good. So you mentioned that you started to do Endolift. Endolift is a technique that maybe not everybody, or maybe yes, know already. So I'm wondering if you would like to tell us a little bit more about Endolift.
Yes, I would, definitely. So Endolift, as mentioned before, is a technology that comes as part of the LASEmaR 1500, which also includes the fractional resurfacing treatment as well. And Endolift itself, by its name, means lifting from within, with its primary outcome, primary aim to increase skin tightening. And with a secondary outcome to lipolyze fat. And for the non-medical viewers watching, that would be to burn fat in a manner similar to laser-assisted lipolysis. And it does this by the use of a very, very small solid-state laser, using a very small fibre, almost as thin as a human hair. And this is inserted just under the skin in the hypodermis, and as such has minimal pain. And throughout the procedure, we then run the fibre across the skin underneath it, and in a sense, burning away the fat and retracting and tightening the skin septum to cause very, very good, excellent results. And what makes the technique very special is that it's minimally invasive. We can do it within half an hour to 1 hour. It has been called the lunchtime lift because theoretically you could come out on your lunch break, have the treatment and be back doing your normal activities. There are very minimal side effects, but as you will see, the effects can be likened to that of a surgical facelift without any of the risks.
Natalie, sorry to interrupt you 1 second. Unfortunately, as you know, we are limited with the technology to this Instagram platform, but maybe we manage somehow with a double video to show a video of you doing the procedure. So would you
Yes,
like
absolutely.
to try to show to the public and see if you can comment?
Yes, of course.
Sorry for this, let's say, not super technological, but I hope something is more or less visible.
Yeah, so as you can see, the light which you're able to see in the video is emitted by a diode at the end of the fibre. And as you can see, it's just under the skin, so no more than a centimetre. And as you can see, the patient there has only a very small amount of anaesthetic, and yet she is completely comfortable. She's completely awake. She's talking to me throughout it. And I can see exactly where I am with that light, and I'm running it just under her skin, and I'm changing the plane ever so slightly, dependent on whether I want to burn away the fat or if I want to more act on skin tightening. So if you can see, the more superficial or the more bright the light is, means that it's closer to her skin. And in that respect, I'm working on really banishing that skin laxity, which is so common as we age. And as you can see, it's a simple concept. I'm simply running the laser back and forth whilst emitting the laser.
Okay, so let me try to make it a little bit bigger. It's not very visible, but the doctor here, what you're doing, you have entered under the skin with a little optical fiber.
Yes.
Right? And then you are moving this little optical fiber to, let's say, create some sort of effect. Can you describe what is the effect that you want to achieve?
So the effect, as I said, has two levels. The primary effect we want is to firm and tighten the skin. And the reason why I'm working on that area in this particular patient is to really firm the skin along the angle of the jaw and around the area where jowls form. And lots of women from 30 above have very loose skin here, and also they lose definition of the jawline. And as you'll see from the before and after photos afterwards, the effect in her and in many of our patients is a fantastic skin tightening effect, which really accentuates the angle and definition of the jaw in such a way that no other non-surgical treatment can really compete with. And then if I move deeper with that filament that I've inserted just under the skin, then there's also an effect of burning off some of the fat, and we can safely burn about 250 millilitres of fat in one session, which then will be cleared away by your own body's lymphatic drainage over the next weeks and months. And overall, you have a fantastic facial sculpting effect.
Okay. Natalie, would you prefer me to show some before and after picture, or you would like to tell me a little bit more about how much time you spend to do the procedure, how long it is, or talking about a little bit more practical issues like, for instance, anesthesia, this kind of thing?
Yes, of course. So it's a very common question we get asked by patients. They're worried about the potential pain. And I have to say that every single one of the patients we've treated are very pleasantly surprised with the lack of pain. It's inserted very superficially, and we can use a local anesthetic that we inject just under the skin. And specifically if we're treating under the chin area for people with double chin or excess skin there, then we can very, very safely and simply inject the anesthetic. And we can do that on the jaw as well. But sometimes we decide not to because of the potential side effects for potential theoretical nerve damage, which we want to be able to see the movement of the face if we're treating the jawline. But overall, it's a minimally painful procedure, and the patient in that video, you can see, is talking to me throughout and is very relaxed. The whole procedure takes about half an hour if you're doing the chin area, and a little bit longer if you're treating both sides of the jaw. But you could expect to have completed both sides of the jaw and the chin in around about 1 hour.
Okay, so basically, let me guide you. Let's think I could be a patient, because Endolift is also for men, no?
It is, absolutely.
Absolutely. So I arrive in the clinic after, let's say, I am a candidate for doing this treatment, and okay, I sit. You propose me to do a little bit of anesthesia, but maybe I don't like to do anesthesia, and I have like a sort of tolerance to pain. Could I do this treatment without?
Yes, you absolutely could. And what we would do is advise you before to take some paracetamol, maybe, not ibuprofen, because that increases the risk of bleeding and bruising. And there are other tools that we can use, a vibrating wand that we can place elsewhere on the face to distract your mind from concentrating on the pain there. And those two combined, or even just the simple analgesia such as paracetamol, would be more than enough to make it bearable. It's quite surprising how a procedure with such good effects can be so minimally painless, but it really is.
How about air cooling?
We can use air cooling as well.
Okay.
We do that. Sometimes we have to be a little bit careful that the air isn't cooling the surrounding tissue to such a degree that we then miss possibly some effect on the nerves. So every technique that we have for analgesia has to be meticulously balanced with the risk benefit, and that's why a pre-consultation is so important to kind of iron out these issues and really tailor each procedure to the patient. Absolutely.
The doctor is always the person that do the procedure, is never the machine.
Exactly.
We have a question. Endolift, at what age more or less is suggested? Would you like to answer something?
Yeah, that's really interesting, because I think in our practice, and I don't know if you agree with me, that we've seen two distinct groups of patients. One is the middle-aged woman or man with skin laxity, jowling, which is giving away their age, when other treatments such as Botox and filler have really well disguised the upper face and mid face, but the lower face is giving away their age. And so with the Endolift, we can really work on that to tighten up the skin. And then we have the younger age group, and that can be from any time in your 20s or 30s. And I do have a before and after which can show this, where it actually works more to sculpt the jawline in a way that fillers can, but this is permanent. And so really, in answer to that question, it depends what you want the outcome to be. If you want to have a more sculpted jawline, sculpted cheek area and buccal area, and you are in your 20s, 30s, that is brilliant. But if you are in your 40s, 50s, 60s, 70s, and you want to work more on skin tightening, then this is also very much the treatment for you.
Okay. I'm sure a typical question when you do your consultation is how many sessions do I have to do, and when I will see the result?
Absolutely. So again, the number of treatments is tailored to the individual. Some patients might see a fantastic result in one treatment, and that's especially the patients with not so much fat and maybe thin skin. Perhaps if you have more fat and thick skin, you may want to repeat a treatment in maybe 1 year. But we monitor this, and as you know, the effects of the treatment keep getting better and better, even at 12 months. So it's a real journey that does keep on improving. And sorry, what was your second question?
My second question was, indeed, I think you answered. It was, if I remember correctly, after how much time I see the result and how long, and how many sessions do I take?
Yeah.
I think you answer both.
Slightly. I mean, we have had some remarkable effects immediately after the treatment, and we'll see that in the before and after photos. But it's really important to remember that the optimal effect is seen at about 3 months, but then it does keep on getting better throughout the following months after that.
That's right. We do collect as a company on an average yearly base, let's say, the results, indication, and the feedback of all the different doctors that do this procedure, and I can confirm that even at 2-3 years there are an improvement, because the body still, mostly in those patients with fatty adiposity, still have an improvement in experience an improvement of the tissues.
Absolutely.
At least this is the information we get from our surveys. Back to my virtual consultation. Okay, I am this candidate patient. I am on the chair. I did or I did not do the anesthesia. Then you start doing the treatment. Let's say in half an hour, 1 hour, I'm done with, let's say, the laser real treatment. After that, what's the procedure? What should I expect? Do I have to stay at home for weeks, swelling, or guide me through my hours, days, and weeks after the procedure?
Yeah, of course. So one of the reasons why it is such a remarkable treatment is that the downtime is very minimal, and in some cases not there at all. You may expect some redness, some mild tenderness, and possibly some bruising, but this is by no means guaranteed. And we will send you home with a compression bandage, which, if it was the face we were treating, would be wrapped around and over the top of your head to help the lymphatic drainage and to really just reinforce the lifting and tightening effect. However, there's no reason why you couldn't go back to work or back to your social engagements the very next day. If there was no bruising. And then weeks down the line, what we've found in our patients is that there's a very mild tenderness and possibly a little bit of swelling, but it also depends on each treatment and how much energy that person has required in the treatment. But as a general rule, you will feel some mild tenderness for possibly a few weeks, and then you should really hope to see the best results and have absolutely no pain or any residual effect after 6 to 10 weeks. Okay,
now maybe, Natalie, if you want, we might want to show some of your patients. What do you think?
Yes, absolutely.
Let's see if the technology help us. Wait a second, there is another question. Is it effective also on the skin texture and fine wrinkles and some spots, or just skin tightening and lifting?
So that's a very good question. And it definitely does have a result on skin texture, and certainly the edema in the short term and long term will smooth out the surface and fine wrinkles. But what we would recommend is to combine this with the light scan, which is just as you know, a separate set that comes with a LASEMAR 1500. And this resurfaces the top layer of the skin and can treat anything from sunspots to acne scarring, or just simply to improve the surface and the texture. So if you combine the two treatments on the machine, then the result is amazing.
Yeah, I confirm that indeed the indication for Endolift is more for skin tightening and laxity, but definitely we see the best result when also the surface of the skin is treated. So the texture is also to be taken in consideration, and this one is why we combine with this fractional non-ablative scanner to reinforce all the superficial part of the skin. Okay, I hope we answered the question, and now we try also this technological advance. So this one, now I start with the last one you sent me. So this is, I have to separate because of platform reasons. So we have a before and an after.
Yeah, and as you can see from the before photo, this is one of the subset of patients I was talking about with more fat, which you can see is both submental or under the chin, and also surrounding her jawline, which leads to really no definition of her jawline before the treatment. And then after, you can see there's been a reduction in the submental fat and some more definition in her jawline. And actually, she's one of the patients that I would predict, and I don't know if you agree with me, Paolo, that would maybe need or want another treatment maybe in a year's time. And that's due to having more adiposity.
Mm-hmm. In the meantime, somebody wrote that a friend had done under her chin. She's in her 20s. It looks really good.
Yeah, and that's an example of how there really is no limit to the age or no specific age category. A lot of young girls and young men come to us and they have unwanted fat underneath the chin. And that is a really quick and simple procedure. If you're just treating the chin with Endolift, it can be done in under half an hour, and the results are really astonishing.
Perfect. Well, let's see some other very great example. Let's go to, this is a little bit cut on the part that we are maybe interested. So maybe it's not that evident. Maybe I go to the next one. Okay.
Yeah, so this lady is the opposite, if you like, of the last photo we discussed. She has very little adiposity, very little fat, and her main concern is skin laxity. So as you can see, she was concerned mainly about skin laxity underneath her chin, and she does, as you can see from the photo, have some very loose skin there which interrupts the definition of her jaw. And then just 4 weeks later, we've significantly reduced that skin laxity and given her far better jawline definition. And she is incredibly happy with the treatment. So it just shows how you have to adapt the technique and the settings according to each patient. But overall, she has got a lot better definition and a lot of skin tightening.
Okay. You have also a comment from a happy patient. I had it done from Dr. Natalie on my chin and jawline. My double chin is completely gone and my cheeks are much prominent. Love it. So congratulations for your...
Thank you.
Somebody also asked, Miss Grassa, that I say hello, your experience in the arms. Maybe we can discuss a little bit later about the body and in particular arms. I don't know if you have had some experience on that or not. If you want to answer, or maybe we talk later and we finish with the before and after. We have another picture, very impressive. What do you prefer?
Yes, we can talk about arms as well. I mean, Endolift isn't just for the face, as you know, and it can be effectively used on many areas of the body, arms included, and also over the abdomen and love handles and the inner thighs as well. And the arms are a perfect site for the treatment, in that a lot of women, more so women in this respect, have lax skin there. It's not so much fat, it's more saggy and loose skin. And so Endolift is perfect for the areas of the bingo wings.
Yeah, there are indication in the body, no? Also, not only arms, also some other area like ankles, inner thighs, gluteus. Have you tried those sometimes?
Yes, I've treated several abdomens. And also the love handle area. We find that it's very popular among women who have had babies, had children, and are left with, again, not so much excess fat, although a little bit we can work on, but also the excess skin after you've had a baby is a perfect treatment. It's a perfect area to be treated with this. And also, as I'm sure you're aware, Endolift can be used very effectively to treat cellulite on the body. And so that's very popular as well.
Okay. Maybe later you can tell me a little bit more about this, because it's I know it's very interesting for a lot of people. But let me go to this before.
Yes, one of our favourite before and afters. So this lady is actually a mixture of the two patients we have seen before in terms of her skin type and texture. So she does have a fair amount of fat and adiposity, and yet her skin was actually very thin. And we think this is why she responded so well. And so as you can see, she has barely any definition of her jawline, and that is taken on the same day. So that's in the evening, and the before is in the morning. And the result is really quite remarkable. She has fantastic contouring of not only her jawline, but also in the buccal area. We've defined her cheekbones and worked on the buccal fat around her cheeks. And the real endo-lifting effect, that is lifting from the inside, I think is perfectly visualized here, because you can see the definition of her jawline, the angle of her jawline, and the entire border has really, really improved.
Yeah, I hope it is visible. I think it speaks by itself.
Yeah,
very
really
good result, Natalie. Congratulations.
Yeah, that was a good client.
Okay. All right, now I switch back to my face. And yeah, you were telling about cellulite.
Yes.
Tell us a little bit more. This is a different indication. It is still an Endolift technique, but in a, of course, totally different kind of pathology, I guess, somehow.
Yeah, we talked earlier when we were watching the video about how working the fibre in different planes can achieve a different effect. And if you are to work more superficially, to work more on retraction of the septum, and to work more at the superficial layer of the skin, you can see a really fantastic, almost immediate effect of relieving cellulite. That, again, similar to when you're treating adiposity or laxity, only improves further down the line.
Mm-hmm. Okay. Have you had, may I ask you if you have had some experience in stretch marks?
I haven't personally, but I have spoken to many colleagues that also use the machine and been to conferences where I know it's very effective to work in parallel, in conjunction with the stretch marks. Mm-hmm. And actually, before the COVID situation happened, we had many clients lined up for stretch marks, and so we are very excited to see them once this is all over. Okay. And to help them with that.
Perfect. Yeah. I guess now it's a long time for follow-up with a little bit more days than expected, I guess.
Yeah, we certainly weren't expecting this.
Tell me a little bit, have you had by chance also some other experience in, for instance, treating granulomas in the same technique, filler complication?
So because we are, one of the first in the UK to roll out the treatment.
Absolutely.
And, over the coming months and years, we will be directly responsible for distributing the machine and teaching other practitioners across the UK. So I think we are yet to see those indications, but certainly knowing how popular filler treatment is and how unregulated it is in the UK, we see so many complications like this. And unfortunately with granulomas, as I'm sure you're aware, they are very hard to treat, and it leads to a lot of patient dissatisfaction. And so I think we will see a lot of these patients. It's not something that I have had experience with yet, but I think we will see more and more. And it's certainly a fantastic treatment for that. Have you had much experience with those?
Personally, I saw cases treated. I read the bibliography. We have to thanks for that the intuition of Dr. Ovidio Marangoni and also the work of Dr. Daniel Cassuto, that I think was end of 2017 presented in the American Society of Plastic Surgery, a paper about the interstitial laser treatment of granulomas, winning the best paper award of the year. So definitely is a good methodology, and the filler is let's say eliminated. The resolution depends a little bit also not only by the technique but also from what kind of material was originally inserted. It was more silicone or a different methacrylate based product. But what we have noticed in the cases are that the volume is reduced, and also the side effect like itching or the so-called biofilm is also eliminated. So the overall well-being of the patient is much improved without the surgical very invasive cutting and opening, or without the use of corticosteroids or other drugs that might have some unpleasant side effects. So yeah, I think it's something that for the people that unfortunately have this pathology, is a good solution to seek. We have also people asking about it. Okay.
Yeah, and I think you made a really good point there about the risks of any kind of surgery. Any risk of anesthesia is quite large, and Endolift provides a way of not having to expose yourself to any of the risks that are associated with cutting using anesthesia, which can potentially be very serious. So for every single indication that the Endolift can target, it has that huge benefit.
Mm-hmm. A question that is maybe unpleasant, but what about side effects? Maybe somebody is also interested in that.
Yes, of course. I mean, it's a question that naturally we're asked a lot by our patients. And the answer is that there are very minimal side effects, and certainly very minimal serious side effects. If you think about the side effects associated with filler, you have the risk of vascular occlusion, which can be incredibly serious. With Endolift, it is swelling, bruising, but some patients don't bruise at all. And I'd say the most prominent, potentially serious side effect is nerve damage, which can be theoretically caused if the fibre runs over one of the important nerves. But I have to stress that there needs to be quite a lot of energy and a lot of time on that particular area to cause such an effect. And so we're very careful when we do the treatment in the facial area to stay away from the facial nerve or the branches of the facial nerve. Because of that, we have a very, very low risk of side effects. And we tend to shy away and not use anesthesia or use very little anesthesia because we can see directly when the fibre has come into contact with one of the nerves, and therefore you can just stay away from that area and be very careful. So it's a theoretical risk, but it's extremely rare. A few of our patients have experienced a little bit of numbness over the treatment area, but that has, at its worst, lasted for only 1 week, and then it goes.
Mm-hmm. Yeah, it's possible. Everything we have been reported so far has always been transitory. Nothing longer than the times you have described. And definitely I would like to stress that, as I said before, the machine in itself doesn't do the operation. It's always the doctor that has to know the anatomy. So we try to, of course, teach or at least explain the area where it's more safe and less safe to go. But definitely it's not a procedure. I don't know, because you said in the UK there is a little bit of unregulated market. I would like to stress that Endolift is only for doctors. It's not for estheticians. So if anybody that is not a medical doctor say they want to perform an Endolift, is definitely not the original. It's something else or something different.
Yes, and it has to absolutely be a doctor, and that differs from filler in the UK, where it can be anyone. Anyone can go on a 2-day course and become qualified. So actually, compared to many injectable treatments, this is far safer in lots of ways.
Mm-hmm. We have a question from Dr. Haidarian, a very, very experienced doctor from Iran. I was in a live a couple of weeks ago, I think. She asked, I wonder if fast hand movement has any impact on the result. That's a very, very good question. I don't know if you want to answer or you want me to answer, because we made some more or less guideline on this.
Yes, please do. Please answer. Okay,
so definitely, I wouldn't like to be very technical about fluence and energy for centimeter, but definitely we try to measure more or less. The idea is to give a sort of uniform speed of retraction, speed of movement. The fiber should move more or less at a constant speed. We identify that speed more or less in 1 millimeter every second. Of course, if this is moved more fast, the dose of energy you give for any given area of the tissue is reduced. And on the opposite, insisting more time, moving more slowly, helping building more the heat in some adjacent area. So the machine comes with some sort of preset parameters, and those are based on a speed of retraction, so a manual movement more or less identified like this. But the reality is that there's always a connection between the eyes of the doctor, the feet of the doctor that control the device, and the hands of the doctor that control the fiber. So one can be more fast, changing the parameter and changing also the speed on which operate the laser. I hope Absolutely. I have answered. Okay. I don't know if you want to add something else. Any other question from the audience?
I'll have a look.
I think I have answered everything I saw, but never know. Other question I might have for you is, just a curiosity, which is the area that you have been asked the most in the UK?
It's definitely the jawline.
The jawline.
Yes, and it's
the jawline.
Yeah, and it's definitely the area where jowling occurs, because that is such a concern for women as they age. And as you know, the loss of bone and the loss of fat in the mid face causes this sagging, which you can see with a deepening of the nasolabial folds, and then ultimately formation of the jowls. And before Endolift, before we had the technology, we had so many patients come in and ask for a permanent solution to that, and we could use filler and a combination of injectable treatments, but nothing like what we can now do in Endolift. So the second we started rolling out, we had a lot of very happy people.
Okay, that's good. We also say hello to Dr. Roberto dell'Avanzato.
Oh, hello, Roberto.
Join us. And Natalie, I know that you are also busy because in this time you have also some other duty to do. Wait a second. What about treating the knees area? What is the average amount of joule you could use to achieve good results? This is a question I don't know if you want to answer or you want me to add something about joule and energy.
Well, I mean, I think the amount of joules per area is an interesting question, because it varies per person, and it really is, or there really is no one size fits all, and it's a very visual parameter. So, I mean, I think when I first started, I was using about 400 joules per jawline, and maybe 300 joules on the cheek, but soon realized that it really depends on the skin type and the amount of fat there, and you have to really be feeling the area and constantly looking to see when you should have to stop. But I think anything from 400 to 500 is a good starting point. I don't know if you would agree.
You're talking about the jawline?
The jawline, yes.
I agree. The doctor, I think he is a doctor, but the person that asked is asking about the knees.
Oh, the knees, sorry. So knees, I think maybe you should answer that, because we haven't had a lot of requests for that. I think, I'm not sure if many patients know that there is anything to be done that's minimally invasive there. So it's certainly a gap in the market that we will look to enter into.
Definitely is something new. I suggest for anybody that is more interested in the dose of energy and parameters, the setting, and all these, let's say, device-related question, to go on our website, eufoton.com. There is let's say, instruction part where it's possible to log on and see our annual event called ILIA, Eufoton Laser Expert Academy, and there are the lecture of Dr. Dell'Avanzato, Dr. Forte and Romano. They did also some last year. We presented some work on the body, and there I'm sure they can find all the setting used by the doctor. Because after, I mean, it is as you said correctly, very, very patient dependent. So a knees, the skin type, the amount of fat, the size of the knees can be very, very different, and the amount of jowl is not our main clinical endpoint to find out when to stop. It's always palpation, pinch test, or visual result based. This is what we have experienced in the face, but also in the body.
Yeah, I'd absolutely agree.
Okay. Oh, I was saying that I know that you are also busy with other sort of things you have to do during this period of, let's say, crisis in the UK. And I really appreciate you took the time to share with us our experience, your experience. Hope to see you when we start again doing events. And if there are no more other questions from the public, I think we say hello to next next time, Natalie.
Perfect. Thank you so much for having me. I'm a huge advocate for Endolift and Eufoton. I think the technology is fantastic, and I feel very proud to be able to use the technology.
Thanks a lot. Thank you. Thank you very much.
Thank you.
And
Bye-bye.
thanks to everybody that is watching, and for those that lost the first part, the video will be available for the next 24 hours in our website, and see you next time, and hopefully see you live when this is all over and we go back to work.
Yes, I'm looking forward to it very much.
Thank you.
Take care. Bye-bye.
Bye-bye.